Part 2 of Chapter 11, everybody. Back to it. I'm going to try and speed up a little bit and just, I think the most benefit is going to be, pointing out those key specific points. And then with the Linus Learning questions, hopefully we can get to those prior to this current group's exam. And we can kind of come back and pick and choose what narrowed specific information the professor wants. So vitamin B5 are played in our mnemonic. Pantothenic acid B5 is formed by the combination of pantoic acid and beta-alanine. Pantoic acid and beta-alanine. Active pantothenic acid forms are associated as prosthetic group 2. We have coenzyme A, CoAsh, acyl carrier protein, these kind of stuff. Let me pull up the actual name. I should say these are components. Pantothenic acid is a component in all of these. The active form of pantothenic acid, you can either say pantothenic acid or sometimes they'll say pantothenate. That is its active form. Either of those, its active form, it's fine. Some of the functions, main function is going to be this guy right here, that it is structural component of coenzyme A. We know how important coenzyme A is. It needs to do a whole bunch of stuff. So that CoAsh participates in these different reactions. We have oxidative decarboxylation as a coenzyme in ketone body synthesis within the citric acid cycle, in fatty acid oxidation, fatty acid synthesis, acetylation reactions, all these kind of stuff. We'll come back if as these pop up on Linus Learning. We'll go through each specifics. Some of the sources. Again, meat, milk, those animal products, and it's also synthesized by some of our microorganisms in the gut biome. Pantothenic acid deficiency. It's going to be a dietary deficiency. It's extremely rare as it's found in a lot of different foods. Some of the symptoms: general fatigue, headaches and personality changes, general weaknesses if you have it. You can also get something that's called burning foot syndrome. This won't be on your test, but this is kind of for future, more for boards. You get a burning pain in the foot, also sometimes described as like a paresthesia of the foot. Paresthesia meaning like an abnormal feeling in the foot. Again, same thing with RDAs. Don't worry too much about those. If you have extra time, learn some of them in general. Around 5 is what we want. And again, about half that in children, a little bit more if you're pregnant or lactating. Tall, rich, nudist, played pickle. Vitamin B6, aka pyridoxine. The active form of pyridoxine is going to be our pyridoxal 5-phosphate. Pyridoxine, pyridoxal phosphate, pyridoxamine phosphate. So this kind of form, the active form is vitamin 6 is pyridoxal phosphate. You can add in the 5 or not. Pyridoxal kinase, followed by the action of pyridoxal oxidase. Pyridoxal oxidase finally catalyze the synthesis of pyridoxal phosphate from either of the 3 naturally available substrates. So these guys right here, any of these get acted on to turn into the pyridoxal phosphate. So you want to remember these names, you want to remember the active form name, and they do transamination reactions. They also, as we learned a couple chapters ago, our vitamin B6 is also going to be a big part of we have heme biosynthesis. In general, you can just kind of say amino acid metabolism. So all of those things that we talked about before. Remember the creation of dopamine, the heme biosynthesis, that whole chapter, it was 2 chapters ago, I believe it was chapter 9. All of those, amino acid metabolism, those special products, or a handful of those special products, use our vitamin B6. So again, heating, light, general food processing, break down B6. Natural foods, those cereal, whole grains, meat, liver, fish, poultry, all that kind of stuff. Again, the actual food sources, unless your teacher specifically gives you like, hey, this specific food has this, like gives you like one specific food, don't worry too much about memorizing all of these. Okay. Vitamin B6 deficiency. It can occur because of these reasons: lactation, alcoholics, isoniazid treatment. I don't even know what that is. I've never heard of that before. Isoniazid treatment. That is used for the treatment of tuberculosis. Interesting. Anyways, tryptophan biosynthesis requires this. Tryptophan is required to synthesize vitamin niacin. Pellagra is also associated with vitamin B6 deficiency. So while it isn't a true, Pellagra isn't a true vitamin B6 deficiency, it's more of that niacin deficiency, so that vitamin B3 deficiency. It can be associated, that's the keyword, associated with vitamin B6. So if you get some kind of question that is talking about Pellagra can be associated with which of the following B vitamins, and vitamin B3 niacin is not one of your answer choices, but B6 is. Best answer is going to be niacin. Second best answer is going to be B6. It's also required for transsulfuration reactions. This type of reaction converts methionine to cysteine, so that homocysteinuria and cystathionuria are metabolic markers of vitamin B6 deficiency. If you're going to ask a question, that will be a question that will be asked about vitamin 6. Mental confusion, dermatitis, microcytic anemia, convulsions, depression, some of those symptoms. Anemia, so we don't spend a lot of time talking about anemia until try 4, try 5 is when you start to really dive into anemia and what anemia means. I'll give you a couple little details. You have a couple different types of anemia. There's 2 parts. So you have normocytic, normochromic anemia. Let's break down all of these different words. So you'll have, actually I should do this first. So we'll have something cytic, something chromic, and then anemia. Anemia in general means it's talking about less red blood cells. Okay, so we have less red blood cells, which means our hematocrit is low. You don't need to know all of this for the test. Don't worry. You might see a word or two later on, especially when we talk about B9 and B12. But we don't need to know all of this for this test. This is just going to be a little intro to anemia. So anemia means you have less red blood cells. So there's a couple different types of anemia. Normocytic, normochromic anemia. That means that our blood, the cytic is referring to these cells. I guess I'll just add on to this. Cytic refers to size / shape of the cells. Normo meaning normal, their normal size, normal shape. Chromic refers to the color of the cells. Remember, what gives it that nice, rich red color? It's iron. So normocytic, normochromic anemia means normal size / shape and normal color, but overall reduced amount of red blood cells. You'll also see microcytic anemia. You could sometimes they'll drop off the normo part. This would technically be microcytic normochromic anemia. Micro, small, so red blood cells are smaller in size than normal with reduced overall amount. You'll also see macrocytic normochromic or macrocytic anemia, and that means red blood cells are bigger in size than normal, but again, overall reduced amount. And what you'll only see with chromic, you'll normally see some type of like normocytic hypochromic anemia. The hypochromic means so they're normal size and shape, but lighter in color because they have less iron. So something like iron deficiency will cause that. That's a rough overview of the anemias that you'll see. We'll talk a little bit more when we get to that vitamin B9, vitamin B12. Oh, we skip. Interesting. I don't love that we skipped, so let's go see if we have B7 anywhere. Okay. I don't know why we went out of order, but I'm going to stick going in order. Vitamin, aka B7. B7 is going to be our ball, tall, rich, nudist, played pickle, ball. B7. So a large portion is supplied by intestinal bacteria in humans. Other sources of biotin, yeast, algae, and plants. Synthesized by using a coenzyme, a thioester, of all this fun stuff. Some of the natural foods, corn, soy milk, egg yolks. This will be the one that he'll most likely ask you. Egg yolks. Egg yolks are a big source of biotin. Sometimes the other question that will get asked, either here or in future tests, was that there's actually a protein found in egg whites called avidin. Actually destroys biotin. So yeah. That's why having some egg yolks is good, and just straight egg whites doesn't give you the full nutrition that you might get from regular eggs. The biotin absorption is transported across the intestine. It actively crosses the blood-brain barrier. The active form, we want to know that, is carboxybiotin. Sometimes it is also going to be called biocytin. The functions of biotin, a lot of it's going to be, again, carboxylation reactions. So all of our carboxylase type enzymes, so adding a CO2 it's going to be that. Remember, like our acetyl-CoA carboxylase, this guy right here specifically, is involved in lipogenesis, so making of fats. So that's the one. If he might ask a question about some of these, but that's the most common one that gets asked. A whole lot more information with biotin and some of these functions. Again, I'm not going to spend a lot of time on these unless they're in the Linus Learning questions. Just for time's sake, honestly, reading through all of this isn't going to be the most productive as far as learning that material. And actually, here's the deficiency. The egg white contains a heat-labile protein, avidin, combines very tightly with biotin and prevents absorption of biotin from the intestines and causes biotin deficiency. This very often is a question. You can also get dermatitis, retarded growth, loss of muscle control, alopecia, aka hair loss, specifically unexplained hair loss, a loss of appetite, and immune deficiency. Okay, that is vitamin B7. Let's go to 9. So this is B9, folic acid, aka folate, aka I guess folacin. I've never seen folacin used before. Active forms, I'm sure we'll get there, but it's literally this first line. It is essentially obtained from diet or intestinal microbes. Folate is doubly oxidized form of THF, tetrahydrofolate. The reduction of folate forms the active coenzyme, the tetrahydrofolate. You may also see it in the form of methylated tetrahydrofolate reductase. Is another way that you might see it written. But yeah, THF, best form. If THF is an answer choice, MTHFR is the second best choice. It consists of pteridine, the aminobenzoic acid, and glutamic acid. Here is the structure. The source, bioavailability and absorption of folate. Again, this is from obtained from the diet or intestinal microbes. Most dietary folates are polyglutamate derivatives, are derived from plant and microorganisms. So, in general, the answer to this type of question, so where do you get it from? It's going to be from microorganisms of the gut biome. Is going to be kind of that answer choice. More than likely won't ask you about this source. The active form of folate is reduced to tetrahydrofolate. Some of the functions we talked about our B9, how it does those 1 carbon transfers, those methyl transfers. That was, I believe, chapter 8. Let me double check which chapter that was. Yeah, that was back in chapter 8. So, if you need a refresher, go back to chapter 8 and look through that specific stuff. There it is. Metabolic functions. Our details are in chapter 8. Big thing with folate deficiency, either due to dietary insufficiency, malabsorption, some malabsorption type issues. Think like gut issues, leaky gut, can be a big one. Crohn's. How do you spell Crohn's disease? Crohn's disease, stuff like that. As well as some genetic issues. does he mention here? Right there. Neural tube defects and other birth defects. You'll see there's something called spina bifida. Usually occulta is the one that you'll talk about the most. This is why pregnant women take supplements while they're growing the baby, especially supplements high in B vitamins, especially folate, folic acid. Typically they take like a specific one, a specific pill for folate or folic acid, or it's like that's like the big thing with prenatals is that they have folic acid, because if we do not have enough folic acid, you get a lot of issues with the baby, like baby not forming properly, mental retardation type stuff. The spina bifida occulta essentially means that like the spinal column, this is more like for chiropractors why we think this is a big deal. The spinal column itself won't fully form, so you get some of the posterior elements of the spine. The spinous process, the lamina, pedicle, that kind of stuff doesn't form, and so you can actually get a peeking out of the spinal cord, which can be extremely dangerous if you don't notice those signs or don't check for something like that, because if you adjust right into that spot, you can literally poke right in and poke the spinal cord. So important thing to be aware of. I don't think you're tested on it in this course, but most often if you do have a case of spina bifida occulta, a lot of times you'll see like a tuft of hair at that in that area. Let me pull up a picture of that. Kind of some more extreme cases, but you can see like these tufts. They're usually not as extreme as that, but like a little tuft of hair. And there are different degrees of spina bifida that you can have, where sometimes like the spinal cord actually goes out. Other times, it's just kind of there's a gap in the bones of the spine. So this is the one that we really, really care about. So other things, it leads to megaloblastic anemia. Megaloblastic anemia. This is let me actually see. I'm pretty sure. Yeah. Megaloblastic anemia is a type of macrocytic anemia. So you'll see either of those kind of used interchangeably. Megaloblastic or macrocytic means the same thing. Also, B9 and B12 are very, very common, or are linked both with your megaloblastic, aka macrocytic type anemia. So if you do have somebody who is anemic like this, a lot of the time what they'll do, if they catch it early and there aren't other signs, is essentially they'll either test for both these specifically. In the meantime, they'll typically just put you on a supplement for both. Sometimes you also, if you can be deficient in both of them as well. So there's another type of anemia called pernicious anemia. This is when you have both vitamin B12 and B9 deficiency. Pernicious anemia is another type of macrocytic anemia. And this comes from, rather than not getting enough of the vitamin, it's your body can't absorb the vitamins. So a lot of times with like old age, or if you take a lot of like antacids, that kind of stuff, you start to have issues like your stomach, the acidity in your stomach changes. You lose something that is called, you lose what's called intrinsic factor in the stomach secretions, which is needed to help you absorb like the B12. So you get like secondary effects from it. Personally, I would include this with B12, not B9. So if you see pernicious anemia associated with B12, not so much B9. But if it's asking about pernicious anemia and B12 isn't an option, then go with B9. If they talk about, if you have a choice, like if they're talking about B9 and your choices are between megaloblastic anemia versus pernicious anemia, I would pick megaloblastic anemia over pernicious anemia, talking about vitamin B9. We talked about the neural tube defects and other birth defects. It also can be related to cancer, the hyperhomocysteine anemia, the elevated homocysteine in the blood circulation. We've talked before in Chapter 8 about that whole sequence of events of the homocysteine methionine kind of loop that gets made. Yeah. That's most of what is important for... Those are the most important things for our B9. The single carbon moieties. Okay. Finally, B12. B12 is a big one in this one. Cyanocobalamin, aka vitamin B12. Most of the time, you'll see it just called cobalamin instead of the full cyanocobalamin. The active form is when it's methylated. We get methylcobalamin. We have huge structure, all that stuff going on. Active form of the B12, just like I said, methylcobalamin and deoxyadenosylcobalamin. Most of the time, you'll just see methylcobalamin. That's the only one that I remember ever seeing, but just in case he does ask about it. Deoxycobalamin is the coenzyme for the conversion of methylmalonyl-CoA to succinyl-CoA. This reaction occurs in the mitochondria. Whole bunch of extra words. Again, when we get to Linus learning stuff, we'll pull out some of the specifics. Methylcobalamin. This is why this is the main one that people talk about, because this is the form that's involved in the conversion of homocysteine to methionine, and that tends to be more important, as well as the conversion of methyl tetrahydrofolate to tetrahydrofolate. Some of the sources, again, meat, dairy products, fortified cereals, some seafood, again, mostly those animal type products. B12 is synthesized by some anaerobic bacteria which are present in our gastrointestinal tract. A strictly vegetarian diet provides very little, I think it's supposed to be very little / insufficient amounts of B12. The absorption of B12, we already did cover this a little bit. This is going to talk kind of about that intrinsic factor. So vitamin B12 in food is bound to protein and is released in the stomach by the acidic environment, followed by proteolysis of binders by the action of pepsin. You'll learn a lot more about these kind of stuff in the stomach. Pepsin and some different enzymes and stuff of the stomach in Physiology 2, so don't worry too much about those right now. Vitamin B12 then binds to R binders. I'll point out the exact things that you want to remember. A lot of this is kind of just two little extra. R binders are dietary proteins having high affinity for B12. The parietal cells of the stomach releases intrinsic factors. That's an important key thing, which is a 50 kDa glycoprotein. When the B12R binder complexes pass through the small intestine, the R binders are hydrolyzed by pancreatic proteases, so enzymes from the pancreas designed to dissolve proteins, and the vitamin B12 is freed. Free vitamin B12 binds with intrinsic factor. Vitamin B12 intrinsic factor complexes are absorbed via the intrinsic factor receptors localized at the distal ileum, so that towards the end of the small intestine. I'm going to skip a lot of this just because I think this is a lot of extra. This will make a lot more sense if you come back to it after a couple of classes, after a couple of trimesters. That a lot more of this does make sense when you get through like physiology too, and clinical nutrition and general pathology kind of stuff. This is again just talking about that homocysteine to methionine, why that's important. Some of the diseases, again, megaloblastic anemia from vitamin B12 deficiency, and also potentially and or folate deficiency. That pernicious anemia due to lack of intrinsic factor. Again, age is typically a big factor. Hyperhomocysteinemia, because if you don't have the B12, you can't turn the homocysteine into methionine. So because of that, you get a bunch of homocysteine in the blood. And because there's a bunch of homocysteine in the blood, it gets cleaned out, and you also get homocysteinuria, so high levels of homocysteine in the urine. Another big one, you get neurologic disorders. So this is stuff you can get, memory issues, dementia. It's actually listed down below as well, peripheral neuropathy. This will be later on. It's super, super important with peripheral neuropathy. So all these memory loss, dementia, demyelination, degeneration of spinal cord, peripheral neuropathy. With peripheral neuropathy, as chiropractors, and whenever we have, radiculopathy types, burning, numbness, tingling, all that kind of stuff, we think as musculoskeletal, we think radiculopathy, we think myelopathy, we think any kind of nerve entrapment, stuff like that. The other side of things, more like the neurological kind of dietitian food type stuff, we start to think with neuropathy is more diabetes. Diabetes will present typically with what's called a stocking and glove appearance, where it starts in the feet most commonly and works its way up, and then it will start in the fingers. B12 deficiency is very similar to that. You can get neuropathy from B12 deficiency because you need vitamin B12 in order for your nerves to work properly, which is another reason why you get the memory loss and dementia. It's important if somebody presents to you guys at any point with peripheral neuropathy, you need to check and make sure that they're not dealing with diabetes and they're not dealing with B12 deficiency. Because once the nerves get destroyed from diabetes and B12 deficiency, they are permanently destroyed. So if you allow it to progress, they can lose full feeling in their entire hands, their entire feet, and it just leads to tons and tons and tons of problems. I had the opportunity just a couple weeks ago to sit in with I actually got to scrub in on a below the knee amputation because of somebody had diabetic neuropathy. They weren't getting checked regularly. They had a small ulcer develop. The ulcer progressed. Their entire foot essentially rotted. They lost their big toe first, and eventually we had to amputate the leg. I did not do this myself. I scrubbed in and was able to be right up close and personal with the surgeon who was performing the surgery. I also met a new patient that I saw a couple weeks ago. This individual was having some other complaints, but came out that they, in the past, had chronic B12 deficiency, and as a result, no longer had feeling in the tips of all of their fingers or a good portion of their feet. So it is a serious issue. We need to make sure that's something that as a kind of a portal of entry doctor, you keep an eye out for. Okay, I will stop with that clinical stuff, and we'll finish this chapter. I believe all that is left is our vitamin C. Vitamin C, aka ascorbic acid. So biggest thing that humans do not contain the enzyme gluconolactone oxidase that converts all this kind of stuff. So we can't, in other words, we can't get to ascorbic acid by ourselves. Okay, we need our citrus fruits. Vitamin C, think of the pirates. If you don't have vitamin C, you don't get to have you essentially, the condition you get scurvy is what you get. You get teeth falling out, you get gum deterioration, that kind of stuff. A lot of this is kind of extra. I won't worry too much about that. Vitamin C is widely required for metabolism. There's a couple enzymatic functions of vitamin C. Again, we'll look at this. There's a lot of specific examples. We'll look at the line of sorting questions and see exactly what those examples are. It also acts as an electron donor. It's within DNA transcription, DNA repair, mRNA translation, all of this kind of stuff. Scavenger of free radicals, which if we have a bunch of free radicals, they tend to pull and rip stuff off of other stuff. This is a big one. Vitamin C increases the absorption of iron in the small intestine. So this is why, so if you're going to, if you're low on vitamin C, or if you're low on iron, so you have that hypochromic anemia, you also want to increase your vitamin C to help your body absorb iron. This is typically a test question that pops up. Good people like that one. Reduces all of these stuff. Deficiency causes scurvy. Look for those bleeding gums, joint pain, hyperkeratosis, bleeding, that kind of stuff. Large doses of vitamin C, especially chronically, like if you take it consistently, will lead to kidney stones. You get metabolic acidosis. You also get pretty bad diarrhea with megadosing. Diarrhea, however you spell that word. You get pretty bad diarrhea with megadosing of vitamin C. Megadosing is kind of like this, at 1,000 milligrams plus. I think it's 1,000 to 2,000 milligrams. This is actually, they'll use vitamin C as a natural treatment for constipation. So if you're ever constipated, you can try that. You just take a bunch of vitamin C, like either the little vitamin C chewable stuff, or like the vitamin C drink. You drop it in your drink and it dissolves. Either of those will work. Those are our water-soluble vitamins. video went a little bit over what I would like it to. Again, hopefully I'll try my best to get to the Linus learning questions early. If not, I'll try and do a separate video just kind of going through the questions themselves. But yeah, no, the water-soluble vitamins. I'm going to pull this right here. This is most of the most important information that you will see. This specific chart is available, and the link, if you want to get, this is for my part 1 board notes for biochemistry. This is also really good. This gives you a lot of really good information overall of everything. Essentially, it gives you kind of the overall view of biochemistry. All right. Thank you guys for watching, and if you have any questions, comments, concerns, or anything, put them down in the chat, and I'll get to them as soon as I can. Have a great day.